Population health is really, to me, not that complicated. You start with a premise that everybody counts. You're going to count everybody. And the entire population of people that you feel responsible for or accountable, to use a current phrase, right? Accountable care means I have an accountability, I have a responsibility to these patients, whether or not they call me up and say I want an appointment or not. And that I have an accountability for them, and they count whether or not they're sitting in my office or they're outside. So there's this sense which goes back to the very basis of medical care, that special relationship between patient and doctor, that says there's a sacred bond here that goes beyond the transactional, that is an enduring connection, right? And that we call longitudinal patient care, right? Mm-hmm. It's the same simple concept, but then how you play it out in practice means, you got to be able to understand who's here and who's not here and reach out to them and bring the people who are not here in. You have to be able to understand what's happening to my patients, not the things that I am doing to them, but what are all these other people doing to my patients, right? If you don't know that your patient just got admitted to the hospital, you're not doing population health management. If you don't know of all your patients with diabetes, how many of them have their blood sugar controlled, you're not doing population health management. If you don't know how many of your patients have missed their follow-up appointments and you haven't reached out to them, you haven't done population health management. So you start with the premise that I'm accountable for this entire population of patients and everybody counts, and everything flows from that.